As COVID cases are beginning to rise across the country, many facilities are opting to maintain limited visitation to compassionate care visits only. HealthCap has some tips to help you contain the spread. Compassionate care visitation can be provided upon request by a resident or designated responsible party. Visitation appointments should be made in advance and should be limited to a specific area, private resident room, or another private location. Each visitor should be screened for fever or respiratory symptoms prior to accessing resident care areas. Any individual with symptoms of COVID-19 infection should not be permitted to enter the facility or to visit with a resident. Visitors should provide their contact information to assist in contact tracing if needed. Ask visitors to sign a visitation waiver prior to entering the visitation area. If the visitor refuses to sign, document the refusal and maintain the documentation in the visitation file. Visitors need to perform hand hygiene prior to entering the resident care areas and will be reminded to perform it frequently during the visit. Provide them access to hand sanitizer or hand washing sinks. All visitors will be required to wear a face covering or mask. A face mask should be provided to those who do not have one. Ask visitors to inform the facility if they develop fever or symptoms consistent with COVID-19 within 14 days of visiting. Staff should screen any individuals who had contact with the symptomatic visitor for their level of exposure and follow guidance from the medical director and local health department. Always follow state and local health department requirements prior to initiating reopening steps.